Assalamu alaikum. I, Dr. Muhammad Akram, Department of Eastern Medicine, Government College University, Faisalabad. I would like to discuss hemoglobin. Hemoglobin is a conjugated protein consisting of heme and globin. There are four groups and four globin chains in each molecule of hemoglobin. In the normal hemoglobin HbA, there are two identical alpha globin chains and two identical beta globin chains. Hemoglobin combines with oxygen and forms oxyhemoglobin. About 6 to 7 gram of hemoglobin is synthesized by the body each day to replace the heme lost during through catabolism. Types of normal hemoglobin. Adult hemoglobin HbA 97% has 2 alpha and 2 beta globin chains. Adult hemoglobin HbA2 2.5% has 2 alpha and 2 delta chains. Adult hemoglobin HbF 1% has 2 alpha and 2 gamma chains. Fetal hemoglobin in the first trimester, GOR1 hemoglobin has 4 epsilon chains. Fetal hemoglobin after first semester, GOR2 hemoglobin has 2 alpha and 2 epsilon chains. Types of abnormal hemoglobin. Bart's hemoglobin has 4 gamma globulin chains seen in alpha thalassemia in children. HbH has 4 beta chains seen in alpha thalassemia in adults. Clinical notes are hemoglobinopathies. Qualitative abnormalities. These are the abnormalities of amino acid present in the globin chains which are replaced by some other amino acids as a result of mutations. HBS, sickle cell anemia, has valine at carbon number 6 instead of glutamic acid. It causes sickle cell anemia. HBC has lysine at carbon number 6 instead of glutamic acid. HBE has lysine at carbon number 26 instead of glutamic acid. HBM causes methemoglobin. It occurs when iron present in heme, which is in ferrous state, gets oxidized to ferrous state in iron in ferric form is unable to carry oxygen and therefore causes hypoxia and cyanosis in adult. In normal and individual, HbM level remains below 1%. Hammersmith hemoglobin has low affinity for hemoglobin for oxygens. Cole's Colne hemoglobin has very high affinity for oxygen. Quantitative abnormalities. These are abnormalities in synthesis of one or more subunit of hemoglobin. The most common clinical conditions in this group is thalassemia. Thalassemia is due to deficient production of globin chains. In hemoglobin, there are two types: alpha thalassemia and beta thalassemia. Alpha thalassemia, this is due to deficient productions of alpha globin chains. Beta globin chains becomes relatively in excess. If one alpha chain is deficient, there will be minimum to no effect on patient life. If two alpha chains are deficient, there will be alpha thalassemia trait. If three alpha globin chains are deficient, HbH hemoglobin H disease, tissue oxygenation will be at risk. Patient will have both HbH and BOTS. RBC have show Heinz bodies, which results in rapid hemolysis. If all four alpha globin chains are deficient, this condition will be incompatible with life. Baby dies in utero, hydrophytalis, or dies just after delivery and will have BOTS hemoglobin, four globin chains. Beta thalassemia. This is due to deficient production of beta globin chains due to the ineffective erythropoiesis. Here RBC will be fragile. There will be increased level of unconjugated bilirubin and other signs of hemolytic anemia. Anemia will be of microcytic type. Characteristic findings are uh, microcytosis, target cells on peripheral blood smears. Beta thalassemia is associated with HbE, common in Southeast Asia. HbF is not associated with thalassemia. Severe form, beta thalassemia major, homozygous state. There will be severe transfusions dependent microcytic anemia, and elevated level of HbA2, 4 to 6% with a thalassemia major is also called Cooley's anemia or Mediterranean anemia. In milder form, beta thalassemia minor or beta thalassemia trait heterozygous state, there will be mild to moderate microcytic anemia and only a slight elevation of HbA2. Diagnosis: hemoglobin electrophoresis and peripheral blood smear. Myoglobin. It is also called muscle hemoglobin. It consists of single globin chains which is combined with heme group. It is present in red muscle fibers. It combines with oxygen and forms oxyhemoglobin, which serves as oxygen reservoir within the muscle cells. Affinity of hemoglobin for oxygen is more than that of hemoglobin, which helps in providing oxygen to the tissues even at low oxygen pressures. It is more soluble than hemoglobin. That is why it can pass glomerular membrane more easily than hemoglobin and appear as urine after severe injury to muscles. Thank you very much.